Hi everybody, my name is Aisa. I am a pelvic floor physical therapist and holistic fitness coach. So I have a long-awaited question that I can't wait to answer for you guys. Okay, so the question is weightlifting bad for my pelvic floor? So the answer is no. However, it is how you do it. Okay, so we're going to start this off with what is the pelvic floor? This thing. So your pelvic floor is a sling of muscles that rest at the base of your pelvis. So your pelvic floor are muscles. They're muscles just like every other muscle in your body, but these ones are a little bit more special. So you have them in the front, right through here. You have them in the back, right through here, but you also have a left and right. So I'll get rid of that for now. So weightlifting is going to affect your pelvic floor in a negative or a positive way. It's just going to be a matter of how you do it. It depends on your body's mechanics, if you're ready for that activity, and other outside factors in your life. When we think about weightlifting, we have to think of the big picture. You're not just a person in the gym, you're a person with other things going on outside your life that's going to affect your entire system and your pelvic floor. So you go to work, you have a social life, you take care of your family maybe, you might clean a few messes throughout the day, you might have a lot of stress in your life, you might sleep 4 hours per night, you might be struggling financially. This all plays into the big picture. Weightlifting is an exaggerated activity that your body is designed to handle. Again, it's a matter of how you do it. So I'm not going to talk about this in terms of pregnancy and postpartum like you think I'm going to, but in general because anybody could have pelvic floor problems, whether they're experiencing symptoms or not. So when we talk about the pelvic floor, one of the major things that gets addressed is this core canister. So your core canister being your pelvic floor at the bottom, just like I just showed you right there, your diaphragm at the top, your transverse abdominis in the front, and your multifidi in the back. So I'm going to talk about breathing right now. This is going to relate to the pelvic floor in a second, just bear with me. So whenever we breathe in, air is supposed to move into and out of our rib cage. Whenever we breathe in, air fills our lungs. What this does is it pushes our guts downward towards our pelvic floor, allowing lengthening of our pelvic floor. Then whenever we breathe out, our guts push up as air is expelled. This exhalation is usually pretty passive normally, but under higher loads, like weightlifting, this requires a little bit more force from those core canister muscles. The core canister muscles allow your body to move and function like it's supposed to. They allow you to keep your rib cage in the stack position that you may have heard me talk about before. The problem is a lot of us have a hard time getting our rib cage over our pelvis to attain this stack position. This looks like that anterior orientation, anterior tilt, or having this sway back posture. This can imply that there's restrictions in your rib cage. Then we add load to our body. The bigger muscles on the outside of our body are going to compress to help hold the weight up. The degree of this is going to vary based on the load, the position of the load, and the condition of the individual. This can further restrict the rib cage. Having a rib cage that moves is essential for good pelvic floor functioning during lifting. When we breathe in during lifting and we have restrictions in our rib cage and the load is too heavy, there's going to be a more downward force because the air can't move well into the rib cage. This puts more load on your pelvic floor, and sometimes that pelvic floor can't handle it. And this is going to be dependent on some of the lifting activities that you're doing. There's going to be some activities that your pelvic floor might be a little bit more vulnerable to due to the mechanics that your body has. However, your pelvic floor is a muscle like all of the other muscles in your body. It is trainable like all of the other muscles in your body. It's just a matter of how you do it. It's not that you just have a tight pelvic floor or a weak pelvic floor. Those might be beneficial ways to classify in the beginning, but that's not it. Your pelvic floor is a muscle just like all these other muscles in your body. It's a matter of how your pelvic floor functions with the rest of your body. First, it's going to be really important to address those core canister muscles. You need to have the ability to move air in and out of your rib cage so that things just don't push downward whenever you're performing these activities at the gym. In doing this, you'll need more mobility of your thoracic spine and rib cage. You're going to have to address how you breathe, learn how to use your deep core, and learn how to contract and lengthen your pelvic floor muscles. All of these things should happen at the same time whenever you're doing any activity. However, when you lift weights, it's just harder to do this all at the same time unless you practice. You're going to make sure these core canister muscles work first, then you apply this to weightlifting or any type of activity, and then you gradually progress this over time. There's going to be different exercises that are good for addressing different portions of the pelvic floor more than the other. So like I said before, you have a front portion and a back portion, but you also have a left and a right. Hinging-based activities such as RDLs, hip thrusts, box squats, you need more lengthening of this back portion of your pelvic floor. And also you need some contraction of this front portion of your pelvic floor. I showed you some of those muscles there before. So this back portion of your pelvic floor is about right through here. So in hinging-based activities, RDLs, and moving into like hip thrusts, you need to have some lengthening of this back portion of your pelvic floor right here. So you can imagine those are the muscles right through here. You need to have these muscles kind of lengthen. And this is going to occur in things like RDLs, hip thrusts, and box squats. You're going to get that lengthening of that back portion of your pelvic floor. And you probably feel this when you're doing some of those exercises at the gym, such as an RDL. You probably feel those glutes lengthening as you're lowering. So the glutes, they're going to sit way on top of those pelvic floor muscles, but those pelvic floor muscles are lengthening underneath it. Contraction portion, those muscles in front need to contract to help lift those guts up to help you push out of that position. So what's going to happen if you don't have this ability to do that? You might end up using your back, which pushes things more forward and downward, putting more stress on that pelvic floor, potentially leading to symptoms and maybe even reduced performance. Yes, this can contribute to reduced performance because you're not able to load appropriately onto your hips. You're probably loading more into your back, you're probably loading in more to your knee, or putting more pressure on your pelvic floor, as opposed to loading onto your hips, loading onto your glutes like you're trying to do. So in deeper squats, you're gonna need more lengthening of this front portion of your pelvic floor. So that's gonna look like this. So you're gonna need that lengthening to get into that lower squat position, but you're also gonna need that contraction to get out of it. Again, if you don't have the ability to do this, this could lead to symptoms. So symptoms could potentially be pelvic pain, incontinence, abdominal pain, but also back pain. But you also might find you're not progressing like you'd like because your pelvic floor and your core canister muscles are not working well with the rest of your body. So weightlifting is great for your pelvic floor. You just need to make sure that you're doing it appropriately. So my best tips: learn how to get your ribcage to move a little bit better. Address these core canister muscles, learn how to breathe appropriately. Make sure you're getting your form down properly, and then gradually progress over time and make sure you're aware of your body while you're progressing. So hopefully this helped you out. Hopefully you learned a few things. Hopefully you're not afraid of weightlifting if you've had pelvic floor problems in the past. So if you have any questions, please comment below. If you're experiencing pelvic floor dysfunction or anything of that sort, make sure you get going checked out by a pelvic floor physical therapist. They'll be able to examine you for your specific dysfunction. If you have tried physical therapy or pelvic floor PT in the past and you're just trying to get better, get stronger, want to use your core a little bit more appropriately, and just want to lift weights again, please join my Alpha Mobility and Function program. So I'm going to leave the link below. Don't forget to like, share, subscribe, and I will see you guys next time. Bye.